Matt Wood hasn't been asked to shield, not yet, but he is classed as obese and has type 2 diabetes, the kind of combination which is now triggering a dramatic rise in shielding.
As time's gone on, I felt quite vulnerable. Really hard to put into words, knowing that I might be vulnerable all this time and not knowing it really. It's not on.
Shielders qualify for help with deliveries of essentials and only go out for exercise or medical care. An extra 1.7 million people in England will now be advised to shield after new modelling combined risk factors.
The new predictive risk model allows us to identify people who may be at increased clinical risk due to a combination of their personal and underlying health conditions. That's very new. That's not been managed anywhere else, as far as we know, in the world.
Researchers looked at the characteristics of patients who were hospitalised or who died during the first wave of COVID to come up with their new Q-COVID predictive risk model. It weights the significance of factors like age, deprivation, ethnicity, lifestyle factors like weight, as well as existing health conditions and medications to determine each individual's risk.
How much weighting we give to each of the factors varies. And then when you combine them, the weights may change.
So you could be somebody who has a number of quite low-level conditions that each on their own wouldn't affect your risk, but combined, they could be a problem for you.
Absolutely, and this is where, as I said, previously a lot of people with asthma were excluded, as you know. But here, if you've got asthma, as well as your age, as well as your ethnicity, may suddenly put you into a high-risk category.
Many of those identified by the model have already been vaccinated, but 820,000 of them have not and will now be moved up into the group with significant underlying health conditions. GPs say they already knew some patients had needed better protection.
What it has, I think, given us is a little bit more support to acknowledge these patients or people who don't quite sit in the current groups, really.
The new risk model means many more people in England will be able to access phase 1 vaccinations and shielding support. And it is also being made available across the rest of the UK. Carl Dinnan, News at 10, Westminster.